Dr. Melissa Clark's on the phone line. She's a leading voice discussing COVID-19 and the effects in the African-American community. And, of course, she hosts the Real Talk with Dr. Melissa Clark every Monday night at 9 p.m. Eastern on Facebook Live and Instagram. Also, our conversation today will go on Instagram at Russ Parr Show. And if you want to leave some questions for her, you can. She may not have time to answer them all, but, hey, listen, it's up to you. Good morning, Dr. Clark. How you doing?
I'm doing great, Russ. How are you?
I'm fine. Let's just get right to it because there's so many questions. We're talking about, of course, we touched on it briefly last week about blood clots, that they're finding that there are these COVID-related blood clots, and it could be affecting people of color maybe a little bit more. I'm not sure if there's any studies that suggest that. Would that be the case?
Well, that is true, Russ, that we are seeing more blood clots in patients with COVID-19. And it is true that African Americans in general, even prior to COVID-19, are at least twice as likely to have diseases related to blood clots. Now, what do these blood clots do? They can happen anywhere in the body. In the heart, they're called heart attacks. In the brain, they're called strokes. And in the lungs, they're called pulmonary emboli, or PEs, people may have heard of. They can also happen in the legs and cause leg swelling and pain, called DVT. We know the actor who unfortunately had to have his leg amputated as a complication of COVID because of that. Now, that is not the usual thing, but that was an extreme case. And apparently that seems to be happening in younger people as well as older people. So people under the age of 50 are also getting this complication.
Okay. So what are some of the signs I definitely need to go to the hospital now? Yeah.
So, Russ, we're seeing it early in the pandemic. Hospitals were concerned about getting overwhelmed. The message was, don't go to the hospital. Try to tough it out at home. That is changing now. We're now seeing that it's more important to get to the hospital sooner rather than later. With this blood clotting phenomena that we're seeing, you want to make sure that you're not having any unusual chest pain or pressure, shortness of breath, new leg swelling on one side, and, of course, any stroke-like symptoms. And remember the word FAST. F stands for facial droop. A stands for arm weakness. S stands for problem speaking. And T, time to call 911. Because the sooner you get to the hospital with these symptoms, the better, because there are things that doctors can do, treatments, that it makes a difference if you get there sooner rather than later.
Remdesivir is the drug that they're touting as, it's not the home run, out the ballpark kind of drug, but it will help in treating people with symptoms. What I was hearing, that it was more effective with patients that were extremely ill, as opposed to, I'm not sure if they're giving it to people when they have early onset of symptoms of COVID-19.
So the clinical trials were in people who required oxygen but were not yet on a ventilator. So they were ill. It's an IV-only drug, so you can only get it in the hospital. And it did show that it speeds recovery and it decreases mildly the rate of death from COVID-19. So those are important things. Like you said, not a cure, but it does help people. It seems to help people get better sooner. Clinical trials are still going on.
All right, Dr. Clark, let me ask you, when you get discharged from the hospital, because we're seeing evidence where some people were sent home too soon, what are some of the things that they should ask before they leave that hospital?
Absolutely. I'm big on making sure people advocate for themselves. I actually wrote a book called Excuse Me, Doctor, I've Got What? And it talks all about how you advocate for yourself. So these are the 4 questions you got to ask. One is, what is the criteria that you use to admit patients with COVID-19, and why do I not meet that criteria? Number 2, what was my oxygen level today? And you should know that it should be 95% or higher. Number 3, what action should I be doing to take care of myself at home? And number 4, what symptoms should I look for to know that I'm getting worse and need to come back? Know that days 5 through 10 of symptoms are really sort of the turning point. Either you're going to get better or you're going to get worse. So day 5 to 10, rather than try to tough it out if you feel you're getting worse, any of the symptoms I mentioned before, plus worsening fever, worsening cough, worsening shortness of breath, are all reasons to go back to the hospital.
And they can treat you. I was talking to Dr. Clark the other day, and we got to go, but I was saying that a lot of people think once I get admitted and go into ICU, that's a wrap. But that's not the case. A lot of people that go into ICU do go home. And I just want
That is true.
I just don't want everybody to think that, it's a death sentence. Especially when they
right, and neither is being put on the ventilator either. And there are also ways that you can be treated without being put on the ventilator. Lying flat on your stomach is one. Mm-hmm. They also have other machines that help you breathe that are not the ventilator. So don't hesitate to go to the hospital because you're afraid. Go if you're not feeling well, if you feel very sick, and any of the symptoms specifically that I mentioned.
Dr. Melissa Clark, you guys can check her out. Real Talk with Dr. Melissa Clark every Monday night at 9 p.m. Eastern on Facebook Live and Instagram. And you can go to Instagram at Russ Parr Show, and you'll see our doctor up there, and you can ask any questions that you like. Dr. Clark, we'll talk to you again next week. I appreciate it.
Absolutely. Take care, Russ.
All right. Bye-bye now.